Welcome back to another COVID-19 update. My name is Dr. Jim Collins. My topic today is supporting healthcare workers throughout the COVID-19 outbreak. I've worked with healthcare professionals for 30 years. These are really good people. They work long hours, they're on their feet, their back hurts, and they're becoming exhausted. I don't think stress is even the word right now. It's probably verge of burnout. So let's talk about these folks and see how we might be able to keep them safe. Healthcare employees are very hardworking, committed people, are in many ways, they're heroes, as they provide care to chronically ill, frail, and sometimes cognitively impaired older adults in senior living communities across the country. They put in long hours, they go to work, historically when they're not feeling so well, and they spend more time with their residents and coworkers than they tend to spend with their own families. And if you are a healthcare employee in nursing homes, assisted living, home health, and hospitals, clinics, you know, and we really appreciate what you're doing, by the way. Now that COVID-19 is wreaking havoc in America's senior care communities, they're working even harder, taking extreme precautions to reduce the spread of the virus, and they are doing their best to protect their residents during this outbreak. While they provide all their support and care to seniors, leadership and administrative teams must provide their full support to every employee, direct care staff, caregiver, anyone who's in there rolling their sleeves up, help them, support them as they struggle through this national crisis. Now, we have to think about protecting our staff through constant cleaning and disinfecting. Housekeepers are doing a great job at this. Many places that I go to, there's someone dedicated, like they are the person who's disinfecting everything. Every hour, every shift. It is really amazing. So extraordinary measures must be developed and practiced within senior care communities to reduce the risk of healthcare employees and their families becoming infected with the coronavirus. Staff, essential personnel, and others must be constantly reminded that the virus spreads through close person-to-person contact. When infected individuals cough or sneeze, they actually release respiratory droplets that find their way into the next person through the mouth, through the nose, through the eyes. We also have to be concerned about surface decontamination. The virus also lives on multiple surfaces found in care centers: wood and steel, plastic and paper, okay? It's therefore necessary to pick up the virus from the contaminated surface, which would be routinely, it is possible, what I'm saying, to pick up the virus from a contaminated surface and object, which should be routinely cleaned and disinfected. Take these extra measures and they can actually help. Taking measures to disinfect maybe hourly, maybe you're already doing that, can help to protect your direct care staff from coming into contact with the virus. Housekeeping can increase disinfection of personal items like computer keyboards, commonly touched items throughout the community, light switches, chair arms, door handles, countertops, tabletops. If you're in a multi-level building, elevator buttons, you know, all of these things we have to think about. And if you've been paying attention to the news and cable and everything else, you're online, PPE, personal protective equipment, might be in short supply, big demand. I hear cases of it actually being stolen. And I also hear really creative things like the nursing home administrator, DON, going out to a hardware store and they're finding masks that construction workers might use. So during this viral outbreak, personal protective equipment is an absolute necessity to protect both the residents, staff, and anybody else. Equipment includes gowns, gloves, masks, N95 respirators, face shields, goggles, or powered air purified respirators, which are PAPRs. These are greatly needed and may be difficult to find. If N95 respirators are not available, many experts are now indicating that regular medical face masks provide similar protection. So that's good to know. We need to continue helping our healthcare teams through training, educating, and reminding. So provide ongoing information about universal precautions, cross-contamination, infection control, and keeping oneself safe and healthy in the workplace. Use live training, in-house training, learning circles, memos, emails, online education, everything that you can to increase awareness of these areas of concern. Remind staff that they are at risk of exposure, but there are many things that can be done to decrease their risk and avoid infection. Self-monitoring is the key. Self-monitoring. We have to be so aware of what we're doing. Employees need to be reminded to monitor themselves very closely for any signs or symptoms of the virus, including a dry and unproductive cough. Fever. This is important about fever. Experts are saying that older employees may not show fever at all. Respiratory distress, difficulty breathing, maybe a sudden onset of aches and pains. If symptoms do appear, employees, you have to alert leadership, your management, or your supervisor and listen to what they say, follow their instructions. What about, and this is one of my concerns, older healthcare employees? Many older healthcare employees have similar health problems as the elderly residents that they're caring for. Heart conditions, diabetes, compromised immune systems. Things like these put employees at higher risk if they should become sick due to the virus. Employers and leaders need to determine something very important. Can older employees be reassigned to safer places throughout the care community and taken off of direct care to decrease their risk? So, keeping employees' families safe. One thing I know that employees are worried about is if I get sick, now I'm going to take it home to my mom, my grandmother, my kids, my babies. Many employees may be concerned and even fearful that they will spread the infection to their homes and their loved ones. This issue needs to be addressed by administration, okay? That's the elephant sitting in the room. You can't deny it. You have to talk about it. Worry and anxiety about transmitting COVID-19 to families can be greatly reduced by communicating how healthcare employees can protect themselves, their loved ones, and their homes. But administration has to take the lead on that. Remind them to practice universal precautions, infection control, prevention, hand washing at home. Make sure their home is clean and sanitized as well. They might bring it from the nursing home to the home. They might bring it from their house to the care community. Okay? So disinfect the soles of their work shoes. Keep a bottle of hand sanitizer at the entrance of their homes. Excuse me. That was just a tickle. Tickle. Because I'm talking too much. Final thoughts. Healthcare employees are used to working long and challenging days and nights. This isn't new. Despite that, COVID-19 does not make matters any easier, and as a matter of fact, it complicates caring for frail and cognitively impaired seniors. It makes everything more difficult. Organizations and leaders in senior care must support their workforce now, today, hopefully a month ago, if they want high quality care and services to continue. Stay tuned for more. I'm Dr. Jim, and I'll be bringing you a lot more information soon on COVID-19.